resources that can support you further. I do think that exposure therapy will be the best course of action for you, and I can provide you some information leaflets on what that is. In the meantime, I think you should start working towards your short-term goals, and we'll catch up next week for an update on how you're getting on. Thank you for coming in today, and if there's anything I can do for you, or if you have any more questions, please let me know.
Thank you so much for everything. I really appreciate it. Have a nice day.
You've reached the end of the patient scenario. To move on to the feedback section, use the right analog stick and push it upward, and make sure it's pointed in the direction of the teleporter pad. Let's have a look at the prompts you've chosen during Chris's interview. Please be aware, we'll be focusing on the prompts you selected that were incorrect. We do this so we can identify areas where you need to improve on. We'll also let you know if you've selected all the correct answers. Okay, I can see from the results that you immediately assumed the patient was suffering with anxiety before asking them for their symptoms. You seem to have jumped to conclusions here. So, next time, take the time to allow the patient to tell you what's wrong with them before giving them a diagnosis. When the patient told you who they feel worse with, you missed out on the opportunity to ask them who they feel better with. This was a missed opportunity to gather valuable information about the patient, which could have been beneficial at a later stage of their treatment. In this section, the patient told you when they feel worse. You missed the opportunity to ask them when they feel better. This was a missed opportunity to gather valuable information about the patient, which could have been beneficial at a later stage of the psychological therapy. Here, the patient told you where they feel worse. You missed the opportunity to ask them where they feel better. This was a missed opportunity to gather valuable information about the patient, which could have proved to be useful at a later stage of the intervention. Okay, I can see here that the patient has expressed they were feeling out of it all. You had the opportunity to ask them to clarify what they exactly meant by that phrase. Instead, you moved on to the next question. In the future, if a patient says anything that you're unsure about, make sure to ask them to explain what they mean in more detail, especially when discussing topics which contain risk factors. Welcome to the Talking Therapies VR training package.